Hi there, I am Cassie Hilbers. I am the program director here at Gothenburg Health Senior Life Solutions program. Our SLS program is located right here at the Gothenburg Health campus. We are located in the old Wellness Center building, or what used to be the physical therapy, occupational therapy space. I have here with me Dr. Knauss. Thank you so much, Dr. Knauss, for being with us today. And Dr. Knauss and I are just going to visit a little bit about our Senior Life Solutions program. Senior Life Solutions is a program for seniors in our community and surrounding communities that are age 65 and older that might be dealing with issues related to depression and or anxiety, and that sometimes can be related to the aging process. Dr. Knauss, why do you think it is important to talk about mental health and wellness in older adults?
So this is often a topic that's overlooked. As adults age, their comorbidity and their list of their chronic illnesses increases, and it leads us to overlook or not address their depression or anxiety. Unfortunately, over 50% of the elderly population start to feel depression and anxiety and actually just presume it's a normal part of the aging process. This is unfortunate, and we actually have ways to help them, such as Senior Life Solutions.
Do you feel like there are particular challenges that seniors face that might affect their mental health?
As they age, their children have grown and have moved out of the house, some even out of the town or even out of the state. Also, they start losing their friends or their other loved ones. It can be a lonely process, and they get moved into nursing homes or assisted livings, and all of this can really affect their moods.
Dr. Knauss, why do you think seniors are reluctant to talk to you as their primary care provider or their loved ones about their feelings or symptoms that might be related to depression or anxiety?
Yeah, unfortunately, in our society, depression and anxiety have quite a stigma associated with them. They're either seen as a weakness or an attitude that they should be able to change all on their own. Mental health does affect so much of their physical well-being, and it can even be hard to realize the symptoms. So they might start feeling more fatigued or having changes in their appetite and sleeping, and they're not even noticing that this is all from the depression. Talking about your feelings can be hard, and they may even be embarrassed.
Can you talk a little bit about what the overall health benefits might be for someone who would participate in a program like Senior Life Solutions?
Yeah, good question. So much of our mental health is wrapped up in our chronic illnesses. Having more comorbidities can definitely lead to depression in many ways. When you are depressed, you're less likely to take care of yourself. So you stop taking your medications, you don't eat right, you stop exercising. All of these are going to lead to worsening of your chronic illnesses. On the other hand, depression can even lead to strokes or heart disease. Therefore, addressing and managing depression and anxiety are very important in our older population. Cassie, I do have some questions for you about the program. As a referring provider, can you tell me more about Senior Life Solutions?
Senior Life Solutions is an intensive outpatient group therapy program designed to meet the unique needs of senior adults living with symptoms of age-related depression or anxiety. That might include dealing with difficult life transitions like you talked about, families moving away, moving into a different home or a smaller home, a new health diagnosis, a diagnosis of a heart disease, diabetes that's new, or the loss of a loved one. Following an individualized assessment, patients meet up to 3 times per week in a group setting, which is supportive and encouraging for all of our participants.
So what does group therapy look like?
So our groups are led by our program therapist, who is a licensed independent mental health provider. Our group members interact with one another. They hear stories, share stories, and work with each other and really develop relationships amongst each other. They learn and grow from each other. What has worked for one person might work for the next person, and they learn how they can incorporate that into their own specific lives. The group setting really allows our patients to learn new coping skills and really develop a positive mindset.
So how does the referral process work?
Anyone can refer to our Senior Life Solutions program. It does not require a provider's orders. So Dr. Knauss, you can refer a patient if you want, but any healthcare provider can refer a patient. A family member can refer a patient, a friend can refer a patient. Even somebody can give a self-referral. All they need to do is make a simple phone call to me.
So what if I have a patient who is skeptical about joining a group setting considering the pandemic issues with COVID-19?
Good question. Everybody's lives has changed because of COVID-19. So here at Senior Life Solutions, we are utilizing a hybrid model of doing our groups. Some people come to us in person and some people utilize telehealth. For those coming in person, we have many practices to keep our patients safe. We're screening all of our patients and our staff with screening questions as well as temperature upon entry into the building. We are masking during group, both our patients as well as our staff, and we are also physical distancing. Every group participant has their own individual table that allows enough space for that 6 feet of physical distancing that we need. Well, thank you, Dr. Knauss, for taking your time today to visit with me about Senior Life Solutions.